For my project, I did Dissociative Identity Disorder. The classification is a dissociative disorder, which are characterized by a disruption of discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. The characteristics are the presence of two or more distinct personality states, or an experience of possession and recurrent episodes of amnesia. Another characteristic is recurrent gaps in the recall of everyday events, important personal information, and traumatic events that are inconsistent with ordinary forgetting. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not a normal part of broadly accepted cultural or religious practices, and the symptoms are not attributable to the psychological effects of a substance such as alcohol or drugs, or other medical conditions such as seizures. And the average person with dissociative identity disorder has 13 to 15 different personalities.
Someone's coming for you, and you're not gonna like it.
I am James McAvoy, and I play Dennis.
Sir, I think you have the wrong car.
And Barry. And Patricia.
I think I'll put a pretty flower in your hair.
And Hedwig.
My name's Hedwig. I have red socks.
Orwell. And Jade.
Wait! No, don't do that. Don't do that. He can't handle reality.
Having to play all of those characters, sometimes in the same shot, kind of really messes with the audience as much as it messes with the actors playing the parts, because it has been nuts making this film.
In the movie Split, which is from the clip that you just saw, the main character has dissociative identity disorder, and he has 24 different personalities, which is a lot higher than the average of like 14. And some of his personalities were Dennis, Barry, and Patricia. And the movie is highly criticized by medical professionals because they say it stigmatizes the disorder and may have a negative impact on people who have the condition, and it is not an accurate representation of the condition. So this movie also shows that the media portrays the condition in a negative way when it isn't always, and also the movie implies that those with dissociative identity disorder are violent towards others when really they are more likely to harm themselves. The beginning and development of dissociative identity disorder. The first signs are memory loss of specific times, people, and events, and also out-of-body experiences, depression, anxiety, suicidal thoughts, lack of a sense of identity, and feeling emotionless. And then as the condition increases, one may feel that one or more voices are taking over in their head, and then the voices can form characteristics and have unique names. People will experience memory loss of everyday events and information. Women are more likely to be diagnosed with the disease, and men are less likely to be diagnosed because they deny the symptoms, and men are often more violent. The main causes of dissociative identity disorder is trauma, and then some types of trauma include sexual, emotional, or physical abuse, tragic early childhood experiences, accidents, loss of a loved one, war, or natural disasters. And then this is a chart that just shows the prevalence of trauma and dissociative disorders. So the first one is just any disorder, and then below that are all the different types of dissociative disorders. And you can see that trauma causes a lot of dissociative disorders. The short-term effects of dissociative identity disorder are severe headaches and pain in other parts of the body. And then long-term effects are eating disorders, sleep problems, and sexual dysfunction. And then the picture is a painting and you can see that the main person is struggling with all the different identities, and the identities are like fighting to become the main one. Avoidance, they try to stay away from things that may trigger past events, and often people with the disorder will deny or ignore symptoms. They try to avoid situations that may cause anger and often try to stay under the radar. To prevent the disorder, you can try to minimize exposure to traumatic events, which sometimes is unavoidable, and you can also try and help those with the disorder. And as a patient, you have to be open about the symptoms and reach out for help. And the intervention is there are a lot of different types of therapy that can be used to suppress the symptoms. For treatment, the goals are to ensure the safety of others and the person that has dissociative identity disorder, and also to reduce symptoms, and they try to connect all the personalities back into one central personality. There are type of psychotherapies that they use, such as cognitive behavioral therapy, which is negative patterns and thoughts that challenge unwanted moods, such as depression, and then another psychotherapy is dialectual but behavioral therapy, which is evidence-based therapy used to treat mood disorders and change in behavior. Another treatment is eye movement desensitization and reprocessing, which allows people to heal from emotional distress that are a result of traumatic experiences. And then these two brain scans, the one on the left is activity in the brain before the eye movement desensitization and reprocessing treatment, and the one on the right is after the treatment. And also medications such as antidepressants can treat and reduce symptoms. And then these are my references.